Thank you, Ralph. And thank you, Dr. Eck, for inviting me to be part of this very distinguished panel. And thank you to all of the wonderful docs in AAPS and all the great work you do standing up for medical freedom for all of America's patients. I'd like you to give yourselves a hand. So it was the fourth day of the trial. The plaintiff's sister, who wasn't part of the lawsuit, was on the stand. "Please think back to the night that your mother died," asked the plaintiff's attorney. "When the doctor came into your mother's room after she passed, what did he say?" The young woman responded, "He said he was really sorry that my mother died." The lawyer paused to let that sink in. "He said he was sorry? Is that exactly what he said?" "Yeah," she answered. "He'd taken care of her for so long that they were good friends." The lawyer's next words were very sharp. "He said he was sorry. He apologized to you. Doesn't that suggest to you that he felt responsible for her death? That he was apologizing for his negligence?" The sister shook her head and said, "No, I think he just felt bad that he couldn't save her. But he might have been apologizing for his negligence." "Well, maybe," she said, "but I don't think so." The scene played out quite differently when the plaintiff came to the stand. Through thick tears, she affirmed that she believed that was exactly what the doctor had been doing. He'd been apologizing for his negligence and killing her mother. Then she said he wished he'd done things differently. That was a claim the doctor categorically denied. During closing arguments, the lawyer relied very heavily on the doctor's apology to convince the jury that he felt guilt for what had happened to the plaintiff's mother. That might have been because his expert witness was soundly debunked by the defendant's witness and all of the published literature. The surgeon's attorney pointed out that it would have been inhuman for the doctor not to express compassion, that the doctor's apology had been simple human decency and not an admission of negligence or guilt. It took the jury 15 minutes to return a verdict for the doctor and the hospital. The plaintiff, who'd interestingly been left out of her mother's will, stormed out of the courtroom. The non-plaintiff's sister rushed to the surgeon and took his hands in hers and said, "I knew you'd win. I knew justice would prevail. My sister just had to do this, but you won, so no harm, right?" No harm, right? The trial took 6 days from the doctor's practice, and since he was a solo practitioner, 6 days of income. 2 anesthesiologists named in the suit also spent 6 days in court away from their patients. All 3 doctors spent countless hours preparing for the trial, taking time away from their patients and their families. No harm done? There were 3 lawyers and 3 doctors at the defendant's table. Since it costs about $150,000 to defend a case in court, the 3 doctors and the 3 lawyers ended up spending $450,000, almost $500,000 in defense costs, for charges that the jury only took 15 minutes to toss out. Even the 2/3 of malpractice cases, which are withdrawn, dismissed, or tossed out by a judge, cost about $26,000 to defend. When a malpractice suit is filed, a doctor's premiums automatically go up. That, of course, is in addition to rates which are already outrageously high in most parts of the country. In Pennsylvania, where the case was tried, malpractice premiums skyrocketed in the early 2000s. While they've gone down a bit, they're far higher than they were 15 years ago. Some politicians say that's because Pennsylvania's malpractice crisis is over. But the surgeon, who paid $20,000 a year in 1999, is paying about $85,000 a year now. That's less than the $100,000 that he paid a decade ago, but it's still outrageous. Surgeons pay as much as $191,000 a year in high tort states like Florida, and as little as $11,000 a year in Minnesota. An obstetrician gynecologist can pay $207,000 a year on Long Island, and as little as $15,000 in Central California, where they have good tort reform laws. High malpractice premiums and low reimbursements are largely what caused 19 maternity wards to close in southeastern Pennsylvania, leaving 6 medical school-affiliated hospitals as the only place you can have a baby in Philadelphia. No harm done, right? It wasn't the surgeon's first lawsuit. He'd been in practice for decades and had been to court before. And the hospital's attorney, he defends his employer all day long. In fact, almost all doctors in all specialties can expect to be sued at least once during their careers. Surgeons and other high-risk specialists can expect to be sued multiple times. In any given year, 7.4% of physicians are sued. 3/4 will have a claim by the time they're 65. Malpractice cases which generate big verdicts also generate headlines. What doesn't make the headlines is the fact that 80 to 90% of the cases that make it to court are found in favor of the doctor. So if the doctor wins, no harm done, right? But the doctor never wins. The doctor loses the moment the case is filed. In addition to the financial cost of defending the case and losing countless hours taking care of patients, not to mention lost income, many doctors describe being sued as the worst experience of their lives, akin to losing a loved one. No harm, huh? But medical malpractice is big business. A Google search for medical malpractice lawyers this morning yielded 18 million results. We've all seen the ads. If you think there's something wrong with you, we can get you money. For plaintiffs, it's a crapshoot, with the possibility of a jackpot, even though they generally only get 46% of every award dollar. Guess who gets the rest? For personal injury lawyers with contingency fees as high as 40 or 50%, malpractice cases are a good investment, even if they only do collect money a third of the time. The consistent money is in the 25% that settle, because fear of an unpredictable jury sometimes drives defendants to settle cases where there really was no negligence. Because you never know what a jury might do. And defense attorneys get paid no matter what happens, so that adds to costs. Tort reforms passed in 28 states have nudged malpractice premiums slightly lower. But while the number of cases filed has decreased slightly, the severity of payouts has increased. On a side note, last year our states, New York, Pennsylvania, and New Jersey, had the distinct honor of being among the top 4 malpractice payouts in the nation, for a grand total of $1.2 billion. While payouts and defense cost a lot, it's defensive medicine that really jacks up costs. 91% of doctors admit to ordering extra tests to protect themselves from the moment every doctor dreads sitting in the witness stand. There are lots of estimates about what defensive medicine costs. The Congressional Budget Office says about $6.2 billion a year. The Rand Corporation says $150 billion a year. Price Waterhouse puts the cost even higher, $210 billion, as much as 10% of healthcare spending. Since multiple factors weigh into doctors' clinical decisions, it's hard to nail down exactly how much money could be saved through good tort reform. And some politicians claim that the numbers just aren't big enough to justify national tort reform. That prompted one national physician leader to note, "The argument that these billions are too small to worry about is the same logic that led us into our current fiscal predicament." An impending problem for physicians is payment structures in the new healthcare law discouraging testing, but doctors will still be legally responsible. Since there was no medical liability reform in the PPACA, and the president's promises of tort reform haven't quite panned out, the House of Representatives passed the Health Act, limiting non-economic damages to $250,000, where tort reforms have reduced malpractice premiums and increased access to care. but there's little chance of passage in the Senate. The worst part is that the current system doesn't consistently benefit doctors or legitimately injured patients. 27% of cases with payouts involved no negligence, but the same studies also showed that a similar percentage of cases with clear negligence received no payout. What are the options? Caps hold costs down and probably reduce non-meritorious cases, but they don't deal with the underlying dysfunction of a medical justice system that really only benefits the lawyers. Several options exist. Early disclosure apology and offer programs have worked at some hospitals. Some states have made it illegal to use a doctor's expression of sympathy against him or her in court. Health courts with medically trained judges or jury panels are an option. I'll admit, I don't know the best answer, but I do know this. Once the Patient Protection and Affordable Care Act is repealed, the Congress and President who repealed it must deal with medical liability reform if they want to reduce costs and benefit doctors and patients who both deserve to be treated a lot more fairly by our medical justice system. Thank you.